People online have speculated that Chris Brown may have had a hair transplant, a brow lift, a rhinoplasty, or even a lip reduction. Are there signs of any of these claims from his photos from over the years? Let's take a look and decide for ourselves. In 2007, at the age of 18, you can see that Chris has a nice shape up with his hairstyle. He has strong temporal points, and these are sometimes what I have to create surgically, but he has them naturally. He has horizontally based brows. He has some upper eyelid dermatochalasis, which is just some excess tissue in that upper eyelid region. He has a wide nasal base with some alar flaring, and he has full lips with upper tooth show on repose when he parts his mouth. Chris also has a strong jawline. And in 2008, at the age of 19, what we see here is a strong frontal brow ridge, which is quite masculine. And he also has full tooth show when he smiles. His upper to lower lip ratio is about a 1:1. In 2009, at the age of 20, when I look at the right side of Chris's hairline, he has this whorl pattern, and that's what gives it some of that irregularity. Now, some patients have a whorl pattern only on their crown, whereas other patients might have whorl patterns along their hairline. I've seen it just in the central part of the hairline. I've also seen it out laterally. So to my eye, Chris seems to have one that's more right-sided along his hairline. Chris also, in these photos, has some slight frontotemporal recession. It's very minimal, but you can see it starting to happen, even though he's only 20 years old. I do have some patients that are in their late teenage years that are nearly Norwood 6 and 7. They've lost a significant amount of hair, even though they're quite young. So sometimes with male pattern loss, it can present quite early and it can be quite advanced. So I was looking at these photos and wondering, could these be some signs of a brow lift here or maybe even a blepharoplasty? Honestly, it's unclear. There are no clear signs of scars. I'm not sure if at age 20 he would have taken the risk with such short hair to get a brow lift, because clearly they didn't do a direct brow lift because we don't see a scar along the brow. They wouldn't have done a, mid forehead type of incision because, he's 20 and this would have been in the middle of his forehead, and his wrinkles aren't yet fully set in where, you wouldn't use that as a potential spot for an incision. An incision by the hairline or just behind the hairline would have been quite obvious to detect with his hairstyle. So I just don't see it, even though the brow to me looks slightly elevated more than before, and there's now reduced impact on the supratarsal area. I still have doubts on whether or not he actually had a brow lift or a blepharoplasty. And in 2010, at the age of 21, I see no change. In 2011, at the age of 22, Chris has started to dye his hair. And you have to make sure when you're dyeing your hair to just practice just safe kind of basic precautions for hair dyeing. And that includes reducing exposure to harsh ingredients like ammonia and hydrogen peroxide. With frequent dyeing of one's hair, you run the risk of developing some brittle hair and also irritation to your scalp. So try to reduce the harsh ingredients and try to reduce the frequency at which you dye your hair, if that's something that you do. In 2012, at the age of 23, I see no change. And in 2013, I also see no change. In 2014, at the age of 25, when I look at Chris's nose, I saw some speculation on whether or not he had his nose narrowed and built up along the bridge. To me, it looks very similar to his original nose. So I would say that I see no signs of a rhinoplasty. In 2015, at the age of 26, when I look at his lip volume, again, compared to 8 years prior, it looks unchanged. I don't think that, at least at this point, that he's had a lip reduction. A lip reduction is a procedure that can reduce the red portion of the lip, either on the upper lip or the lower lip. Sometimes it's used for a global reduction when people just feel that their lips are too full and they're trying to get the upper lip or the lower lip to look just thinner. It can also be done for a localized type of procedure where you're trying to address either a scar or some specific tissue prominence, and so you can just reduce that one area to make the lip look more even overall. You can do it globally or you can do it locally in one specific spot. And I think one of the reasons why people are guessing that maybe Chris Brown had a lip reduction is because they're looking at his lips, but from different distances from the camera. So as we get closer to a camera, our facial features look bigger. And that's why in selfies, most of us have like a bigger nose or bigger lips. As we move away from the camera, the facial features start to look more like their normal size. And so when assessing someone's face and trying to figure out how they had these procedures, it's important to keep in mind facial proportions and not just to jump to conclusions about, let's say, the lips by just looking at only the lips and not in relation to other facial features. So in my estimation, I don't see any signs of a lip reduction in Chris's case because I've looked at those different distances from the camera and how they relate to his other facial features. And when it comes to his hair, the frontotemporal hair loss has slightly increased. You can see a more recessed corner on both sides compared to prior. In 2016, at the age of 27, Chris has started to adopt some of these tighter hairstyles. And remember that a tighter hairstyle can lead to traction alopecia. Because of that pulling on the root of the hair or the hair follicle, you start to build up inflammation. And if you continue to have that tight style, you can start to lose some of those hairs, and it can be permanent if it's not reversed quickly enough. So in addition to some of the risks for your hair associated with hair coloring, make sure to also be careful with how tight you wear your hair. And in 2017, at the age of 28, I see no change, and that's the same through 2021. In 2022, at the age of 33, now that Chris Brown is in his 30s, his cheekbones have become more prominent. And that has to do with, in part, weight loss, most likely, but also as we age, the quantity of fat in our face diminishes. And that's one of the reasons why I speak up against buccal fat removal when people are much younger, because later on they'll be wishing that they had that fat back. But in Chris's case, I don't think he's had any buccal fat removal, but I do see this cheekbone prominence as some of the other fat in the face has started to thin out. When I look at Chris's nasal base and his tip, they look similar to me compared to the original. I really don't see any obvious signs of plastic surgery or say something like a nasal filler. To me, it looks quite similar to the original. Also, in looking at his lips, specifically the amount of tooth show that's there, I again think that it's unchanged. And a lip reduction has the tendency of exposing more of your teeth. So because we see about the same amount of tooth show on the upper teeth and the bottom teeth, I don't think that he's had a lip reduction on either the upper lip or the lower lip. In 2023, at the age of 34, tattoos on the face are not exactly like tattoos anywhere else on the body. The facial skin tends to be thinner than other areas of body skin. And when you have thinner skin, when you go in with the needle to do the tattooing, if you go too deep, which is more likely with thinner skin, you can start to get these bleeding lines and a blown out type of result. Also, our face is more exposed to the sun. So with that constant sun exposure comes different changes to our facial skin, and that can of course also affect the appearance of a facial tattoo. And when we wash our face daily, such as with the Feel Confident facial cleanser, what happens is that the tattoos on our face can start to fade quicker. And when someone is dissatisfied with their tattoo, they'll sometimes either get a different design over the original, or they might want it laser removed. But it is difficult to laser remove a tattoo completely. So when it's on your face and you no longer want it there and you go in for that lasering, what you'll find is that there'll still be some semblance of the tattoo, even though it'll be less obvious, it will still be there. And so that's something else to remember about tattoos on the face. And if someone is interested in getting a facial tattoo, I think it's very important to find a subspecialist tattoo artist who really knows what they're doing with that part of the body. Similarly, when someone is getting like a facial plastics procedure, it's important to go to someone who does this stuff all the time. And the more specialized they are, I think the higher your chance of success for that procedure. And when it comes to plastic surgery, we have our list of recommended plastic surgeons on the Feel Confident website, so make sure to check that out. And this year, in 2024, there's been some speculation about a potential hair transplant towards like the end of last year. When I look through all of these photos, first of all, he's wearing lots of hats lately. So at first I was like, well, maybe there is something there. But he did not have his hat on for the podcast in November of 23 with Funny Marco. And to me, his hair looks pretty much unchanged. And when I look through even some of the highly edited types of images, I think maybe they use some makeup to sharpen some of the lines, but I don't see clear evidence of a hair transplant for Chris. And so to me, I think Chris's hair has been fairly stable since about 2015. And the question is, with the recession that he was developing in the years prior to 2015, how is he able to stabilize the hair and not continue to recede? It's possible that that was just his pattern, that he was always destined to have that pattern and it wasn't going to get worse on its own. But it's also possible that he actually started medication to help stabilize that hair. And the main medication that does that is finasteride. Finasteride is most commonly prescribed as a pill, something that you take daily, but it can also be prescribed as a topical formulation. That is off-label use, but something that is done and is still effective with reduced side effects. So if you're looking to potentially get on finasteride to try to prevent your own hair loss, make sure to check out feelconfident.com, where you can get the medication affordably delivered right to your door. So the brow lift and/or a blepharoplasty is the only potential procedure that I see some signs of. But again, I have my doubts given his age at the time that I started to see those changes and the type of scarring that would have led to. And I don't see the signs of scarring. So even though I do appreciate some change in his brow position, I'm not convinced that he actually had surgery. I see no signs of a lip reduction, a rhinoplasty, or even a hair transplant. Let me know if you agree or if you see things differently in the comments below.